watching Vocal Codes. Breaking news: an FMG A6 has entered the studio. But today isn't about the headline, it's about decoding the journey behind it. Welcome to episode 1. What inspired you to choose your journey in DMSF for MBBS?
For me, it was as I said earlier, it was a surprise and it's out of blue. But I didn't know that DMSF would have such impact on me when I chose DMSF. But when I graduated, I knew how much I learned from DMSF and how much DMSF helped me to become a better physician or a better person in as a person also. Because we learn a lot of discipline from DMSF, the resilience and all those things. And I would say. In this FMGA journey also, being a DMSF student helped me a lot.
And what do you think about the clinical exposure here in DMSF as compared?
I would say you have a good clinical exposure in DMSF because many colleges don't allow students to have clinical exposure at all. They just observe it. They don't have hands-on experience. But when you go to SPMC, you from DMSF, you will have hands-on experience. Or other say any other hospital, you will be taking history, you will be doing PE. So that's all. Those are the basics you need to build strong when you are in a medical school. So I think DMSF has a lot of clinical exposure. Also, OSCEs and those things. People doesn't. Yeah, I didn't know the importance of it until FMG because. So when I prepared, I remembered the cases which I solved in the ASCII stations. So those also helped me during the preparation. I think it's more than enough.
Yes. Like, how did that every OSCE station, the TBL sessions, SGD sessions, and ASM, especially the history taking skills, how it really changed it in also in clinical experience exposure and also in FMG preparation, how it inculcated in you? Like, can you
So
say
I
about
would
that
say
few words?
building the knowledge in ASM in second year is very important. So that would be very useful if you have a strong basics in your ASM when you come to your fourth year of rotation. So when you're in your fourth year or right from your first year, you have TBL sessions for biochemistry and physiology and all those things. So in that thing, those also you will be reading a case and you will be knowing all the signs and symptoms and how to treat the patient or how will you examine the patient, what are the diagnostic tests you have to give to the patients. Those are the things you're ultimately going to read again in FMG preparation. So I think you have to give equal importance to all. Don't just think it's just a school session, it's just a 1 day session. It will be like, I just have to get through this test or this exam. It doesn't work like that. So for me, I think the OSCE stations, especially during my clinical rotations also. So you will be having clinical rotations in hospital also, in OSCE also, right? So when you are in OSCE, you will be having patient exposure in there also. Like standardized patients will be there. You will be taking history from the patient, and the patient will be giving you marks. So you will have a you'll have a chance to improve yourself when you're exposed to such situations. So I think it is a very good exposure from DMSF.
Looking back, are there any habits or values you developed specifically at DMSF and later helped you as a physician and also as an aspirant?
Punctuality.
Yes, sir.
Yeah.
The attendance, especially.
Yeah.
If you could relive one day from your MBBS
Oh,
journey at DMSF, which day it would be? From
at
whiteboard
DMSF.
ceremony to the graduation day and the
Uh,
exposure, the first time surgery.
I would say it's February 5, 2025. It was my first day in neurosurgery
Wow.
exposure. Yeah.
Can you take us back to your very first day on campus? What was going through in your mind when you just entered, tapped your ID, and
Uh, so for us, it was the first semester was online.
okay.
So we didn't have, yeah, we were exposed to college only after the second semester in first year. So it was all new because I was not a student of DMSF in for BS. So I was from Broken Share. So I didn't know how DMSF worked at that time. So I think it was all new, but I had friends. So I just adapted to it within a week, I think.
Okay. And you are actively involved in student leadership in organizations like peer facilitator and various other student committees while maintaining your academics. How did those experience help shape your confidence, leadership, and communication skills? And would you like to add some about it, your experience in those committees?
Yeah, I would say like for people who would, for me, like people like me who like to get exposed in a lot of extracurriculars, I like to do that. So uh, that helped me boost my confidence because and my communication skills actually.
Okay.
So and that's all. Yeah.
Throughout all the 4 years, can you give us one subject or one resource that every student in our DMSF must make use of?
Listening to classes,
Okay.
active listening to classes,
Mhm.
even if they couldn't like listen to all the whole lecture. I think for the volatile subjects, they
Mm.
have to listen to the class. So you'll gain a lot than you think when you're listening to classes actively,
And how was
which
the
means
library and learning centers and etc., which are provided by
yeah,
our college?
I make the use of library a lot during my first year. So first year and second year also, yeah. Because in second year you will have a lot of exams back to back because you have nine
Mm.
subjects and you can't go back home to revise the subjects or come back again for the exam. So library was my home during my first and second year.
Sure, okay, can be. Could you give us one subject or more from each year that is never to be taken for granted, taken light, or
In first year, I would say biochemistry because most people and anatomy also. Like most students, I feel they just want to pass the exam for
Mhm.
biochemistry or anatomy, and they don't take it seriously. They don't read the anatomy as it is very important if you want to become a surgeon. So I would say in first year anatomy and biochemistry, and in second year I would say micropara. They study it, but they don't know the importance of it. So I think micropara and patho also, clinical pathology. So clinical pathology. And third year, legal medicine and medical ethics.
Mhm.
So many people try and radio also. They don't give as much importance to those subjects. Uh, in FMGE, there were like around 10 to 12 questions from legal medicine and medical ethics because that is FSM.
Yeah.
So I think that they should give importance to. And in final year, you have to give importance to the whole year because it's your clinical rotation.
Okay. And when was your first GT?
My
And
first, yeah, I did give a GT before starting my preparation when I was in my clinical rotation. So to just know my where I stood in the preparation level. So I think it was around mid of my clinical rotation. I don't remember the month. So
actually,
it's
it
during
takes
my
a
clinical
strength to
rotation.
give that mock test, right? Like before the preparation, giving a
Yeah,
GT is that or a big like swallow your frog in grammari.
yeah. I just wanted to know where I stood in my preparation level. I knew it is going to be bad, and I knew I was prepared for whatever the score it appeared. So,
Okay. And how many GTs before the FMG you gave, Akka?
I gave around 6 to 7 GTs, but I don't remember the exact number.
Okay.
Uh, but the thing is, it's not about how many GTs you give. Some people may say 60 GTs, some people may give 2
Mm.
GTs. So I think for me, I would say at least give 6 to 7 GTs, or at least what how many if you can give more, that's very good, but at least give 5 to 6 GTs because GT, as I said, GTs will help you reduce the anxiety level on the exam day.
Mhm.
uh, I would also like to add, don't use GTs as your assessment of score or predictor of score for the as your main FMG score. It won't work like that because in some GTs you'll have easy questions and some GTs you may have very difficult questions.
Mhm.
So use that as an assessment tool and try to identify the weaker subjects and try to identify the weaker areas and give more importance to that before giving an XGT. So you will be able to improve that. Yeah.
Okay. What were your hobbies, Akka? I want to ask this. You had
Yeah,
hobbies.
obvious.
Were you able to continue
Yeah.
through the school and the preparation?
No, not much, I think, because I like to draw, but I painted and draw only during my BS and first year of med school. Later on, no, I didn't have much of time. And I'm a binge watcher of Netflix, so I didn't also have time to do that also.
Grey's Anatomy or Good Doctor?
Grey's Anatomy always. Yeah,
Always. Derek Shepherd or Amelia Shepherd?
Amelia Shepherd, of
Amel.
course,
Oh,
Amelia.
I
But I'm a big fan of Christina. Yeah.
Christina Yang. Me too, ka. Like that line, I really feel. I always felt that the line "Have some fire, be unstoppable, be
Yeah,
a force of
probably.
nature." Like I always seen only in her television, but when I spoke to you as personal, எனக்கு வந்து உங்ககிட்ட பேசும்போது I felt that okay, someone is really being that kind அப்படின்னு.
No, compare me with Christina. You're not doing justice to her.
Thank you so much, Akka. And
You.